To the 2021 Eritrean Festival in Washington, D.C.
This exhibit will be looking at the healthcare system in Eritrea before and after our independence in 1991.
My name is Adiam Outbay.
And my name is Asmait Solomon.
The healthcare achievements of the EPLF before 1991 are notable. In the early 1970s, the Liberation Front had only a single mobile clinic, and a vast majority of the country had no access to modern healthcare. During those times, they relied solely on traditional healers, but by the late 1978, the Front had developed a comprehensive service that treated 1.6 million patients per year and epitomized the World Health Organization's guidelines for primary health care. Today, we have invited Eritrean healthcare workers who will cover preventative medicine and treatment such as first aid during the armed struggle.
Soon after independence in 1991, the Eritrean government took initiative to ensure that healthcare was free and is still free at the point of care, tailored to rural and marginalized populations, and focused on prevention. It aims to eradicate contagious diseases, promote public health, and take a scientific approach to traditional medicine. The government motto is to leave no one behind, and prior to independence, there was only one referral hospital in the capital city of Asmara, requiring people to travel long distances from all over the country to receive care. After independence, the government was able to build a referral hospital in each subzone as well as clinics in every village. The government has since taken major initiatives to solve and expand healthcare of its people by starting medical school and expanding the existing nursing school. We invited health professionals to discuss major advancements such as surgery, treatment of eye, ear, oral, and gastrointestinal, cancer, musculoskeletal, and reproductive health and childbirth. Please stay tuned. Thank you.
حزب مالي ما يحدنا زمان دازمري بصنعاتو بتوفيتو عوز خمري حزبي مالي زي بنتك زي نسلسل أبو سمري ناي سلام أبنت.
Okay, hello everyone. My name is Asmait and I live in Dallas, Texas. And the purpose of this interview and the goal for this interview is to explore the Eritrean healthcare system before independence. We'll talk about preventative medicine, treatments, the challenges in healthcare, the challenges that healthcare professionals faced and how they overcame those challenges. My guest today is one of our own, Haddas Hailom. Haddas is currently practicing nursing here in Dallas, Texas. Nurse Haddas, thank you for taking the time to talk to us today. Please tell us about yourself.
أنا حدث حالهم بهال مشان تعتمدين عن شو أكتن نعميدا مستزنا برا وحزيناي.
My name is Haddas Hailom, and I joined the armed struggle for independence in 1977 when there was a high sense of patriotism and youth were joining the movement en masse. I wanted to know why you became a nurse.
ونرسي كل جزء نزيد خمة نزحمة نتتسنى في خطر كلها كتحجز كلها حيموز نور حاول خطر كلها.
I became a nurse because it gives me great personal satisfaction to help the sick and the needy. And what kind of patients were you treating in Meda? Were they the civilians or Tagaralti or both?
أنا كم مبزحتو أبتنا يقط هدراوي بوتاس لزنوركو سيبل مبزحتو أبت زنبرنا بوتانا وبوتاس لزقني أي موصوني من نبانا جد نقدمنا نرخبهم الله قد أمتات بدربا يخون ويك أحد حد جزيه.
I was assigned to work behind the trenches, so most of the time I was treating fighters. And in some rare circumstances, we would encounter wounded civilians and then we would treat them. But otherwise, the EPLF had a special unit who were assigned to treat just the civilians. And where and how were you treating patients?
وحمومات قالت بيشنت هنا قاعدة مبزحتو مسكينة تتحازن أي موقعتي حجي كمتي مجمري أزبل بخي مستسلفون أقر حكمنا تماهيري أبصر قد أمالتيو نافنا يوتهدرا وزنبرنا.
We were both fighters and nurses at the same time. We were trained to do both. Most of our patients were fighters, so in that sense, our primary duty was to control any excessive bleeding, as well as moving out injured fighters to a safe place at a safe time for more and better treatment, or to even send them behind the trenches to the hospitals. And were the supplies easily available?
Supply نيرنا لكن هزبا قنبار حياة الود بندي حدا تواقي خفت تسألائي تعطق.
Yes, we did have enough supplies. And EPLF was a very strong and smart organization, so the supplies used to come from our civilian population, as well as any captured war materials and supplies from the enemy. And how and where did you develop medications and treatments?
أتنايتي مدهنتات كما يقول لك نحنا كم مدهنتات بوزح يكوننا نحسب دفع.
As field nurses, mostly we used to carry medicines such as chloroquine for malaria and other minor medication, as well as some vitamins like vitamin K. These substances help to thicken the blood and stop bleeding normally. And what challenges did you overcome as a health professional during the armed struggle?
أو قال تقال لي كل جزء خمسة محيالي الكعبتي مسرتنا تي قال لي تي challenge ناتخا تايت بدها تتعوزقات مكا.
Being in an armed struggle and being a freedom fighter was very difficult because there were times where there were challenges that we faced and shortcomings. For example, there would be times where we had a shortage of supplies and we were facing an enemy that was very well equipped. And the fight for survival issues were continuous, such as treating injured fighters and then hiding from enemy warplanes to unpredictable weather, you name it. The challenges were beyond what most people can take. What did you see with healthcare in Meda over time?
عميدا أتي كارت التسلف كله زنبري درجة ناي حكمنا أفتح دحرة إذا أكون أزيو سماين مريتن معبادنا إزواج مبارنة حكمنا رأي نتايش.
From the time that I joined the Freedom Fighters, EPLF, until independence, the percentage of casualties with abdominal wounds was unprecedented on the battlefields. It was almost 1/4 of all wounded fighters. Roughly 95% of these casualties die almost immediately from bleeding. Wounding agents are most often either bullets or fragments from various detonating devices. But later on, like Dr. Wittenberry adopted a system in which abdominal injuries were quickly treated at the battlefield and then sent to hospitals behind trenches. EPLF built the first central hospital in 1975 in a concealed mountain ridge valley, then built Orota Central Hospital in 1978. Orota was 6 kilometers long, camouflaged under trees and carved into the rock of a mountain valley. Orota housed 3 underground operating theaters able to provide complex reconstructive surgery, a radiology unit, and specialized medical and surgical wards. It also contained a pharmaceutical plant capable of producing over 240 liters of infusion, 80 million of 32 essential tablets, and 40 million of 4 different capsules by 1989. By 1984, Orota's hospital was able to treat 99% of war injuries with a 97% survival rate. Perfect. Thank you so much.
But the purpose of this interview and our goal is to explore the Eritrean healthcare system before independence. We'll talk about preventative medicine, treatments, the challenges healthcare professionals faced, and how they overcame those challenges. My guest today is one of our own, Mr. Kidane. He was a nurse and an educator in Eritrea and still practices nursing here in Dallas, Texas. Nurse Ertwit Kidane will focus on communicable diseases such as polio and TB, as well as malaria and immunizations. Nurse Ertwit, thank you for taking time to talk to us today. Please tell us about yourself.
Okay. My name is Ertwit Kidane. Education, I graduated from Asmara Nursing School in 1991 as RN. And also I continue my education at Asmara University, and I graduated in 1990 with bachelor degree in management. Okay, I work as RN and charge nurse in medical surgical in Asmara, Eritrea from 1981 to 1996. And from 1996 to 2001, I worked as a nurse instructor at Asmara Nursing School. Since 2001 up to now, I'm here in the United States working as registered nurse in dialysis and pediatrics.
That's amazing. Before we start, I wanted to ask you, why did you decide to become a nurse and what responsibilities did you have as a nurse?
Oh yeah, the reason why I joined nursing is because it is interest, you know, my interest, everyone has interest. So my interest is just saving life. Yeah, I was seeing the nurses doing their best and saving life. So just I decided to join nursing school.
Yeah, that's awesome. And as a nurse, what responsibilities did you have at that time?
Yeah, you know, as a nurse, nursing participate in everything, you know. So yeah, I have the responsibility, you know, to assess the patient, you know, to give the medication which is ordered by the doctor, and you know, just you know.
Yeah, it's really important work. Yeah, it's a lot. And while you were a nurse or during the time of independence or before independence, what kind of patients were you mainly treating?
Just the same, you know, medical patients. I was working medical patients as well as in surgical patients. You know, a lot of injury because at that time, there was a war.
Yes.
War between, you know, between whom? Do you know? Because there was, before independence, EPLF, you know, Shabia was fighting with Ethiopia soldiers. And a lot of injured people were coming to our place. Even some patients from Shabia were coming and we were treating them.
So were you were your patients civilians as well as Tagadalti?
Tagadal, some. I cannot say many, but some very injured Tagadalti were coming and we were giving very good care to them.
What hospital were you practicing at?
I was working at military because we have to go anywhere. I was working has hospital specialties designed to police people and their family.
Okay, got it. So next, we can go over the different diseases you had to treat. First, I want you to tell me more about malaria and polio and how you treated those diseases at that time. And what challenges did you have to face when you were trying to treat patients with malaria or polio?
Yeah, malaria, there were a very, almost 2/3 of the Eritrean people was attacked by the malaria area. And I can't say it was, before independence, there was shortage of nurses, nurse assistants, there were less clinics in the area. So the people were not getting enough treatment, and they were dying, a lot of people, especially in Tesane and other low areas. Okay, but we are doing our best. It was the treatment was the chloroquine, we are giving them, but still, it is not only that. The people, the community should be educated how to prevent. They need to be provided mosquito nets. They were not be given at that time. And there were not assigned people from the community to teach them how to prevent. The prevention, for example, what areas multiply mosquitoes. The mosquito give the malaria, because if I am infected with malaria, the mosquito will take my blood from me and will give the parasite to the healthy people. So, the education as well as health personnel was not enough. So as a result, many people were dying, the transport was not enough, and they cannot even reach the regional hospital. They were dying. But after independence, a lot of human resources were trained. A lot of clinics were, built, and even there were, there were people who are assigned, there were a team who are assigned especially for malaria, to educate the people, to educate the community. And transport was also improved, and they can go to far villages and give the treatment. Even they can, they were training from the village agents, and to observe the sign and the symptom of malaria, as well as to give medications like chloroquine. They were educated. So as a result, it improved. Very improved. As, this is for malaria. So malaria improved after vaccination. 1997, 1998, it was good. It's improved. The rate was low.
And when they started providing vaccination for it, was it easily accessible for everyone?
They don't give vaccination for malaria. They give the chloroquine, and they were another medications, and as also if they are healed from malaria, they develop immunity system, so they will not be attacked easily.
Okay, and
it is really education. It is education. Education the people.
And what about polio during that time? What challenges were you facing when?
Polio, polio, polio was given this oral oral medication that was given for polio. Yeah, it was not very high even before independence, but after independence, it is almost gone because of the teaching, because of giving medication, taking the oral vaccination for the children as well as, adults.
And
so
for those who may not know what polio is, could you briefly explain what polio is and what caused it?
Oh, polio, okay. Let me see. I know, oral polio vaccine, the children's immunization, EPI, expanded program immunization, the children vaccine necessary in Eritrea were BCG means Bacillus calmette glorine, TB for TB, DPT, diphtheria, pertussis, tetanus, OPV, oral polio vaccine. This oral polio vaccine, if you didn't get it as soon as possible, it makes the muscles weak, even paralyzed. So, yeah, that is what I can say so far about polio. And polio, at this time, is almost none. Even the World Health Organization just approved that in Eritrea, polio is not, it's almost zero.
Did you personally have any patients that came with polio?
No, I don't have in the place I work.
Okay.
I see some. I mostly they are seen in the big hospital, pediatric hospital. But I was working in Hazhaz hospital. In the pediatric unit, I didn't see, but there they told me there are some, and as a result, especially those who did not get the vaccine from the rural area, they are being attacked by the polio by the polio.
Okay. And then besides malaria, what other major infectious diseases did you have to treat patients for?
Oh yeah, like meningitis, TB, typhoid fever, tetanus, rabies, all these were, we were giving them treatment, and it was improved. Really, the vaccination was good in before. I can't say the vaccination was bad totally in before independence, but after independence, it is very improved because the human resources increased. So the nurses were going from house to house and teaching the people to get the vaccination, from school to school to get the vaccination. Like I say, like BCG, like diphtheria, pertussis, tetanus, which is abbreviated as DPT, oral polio vaccines. Yeah, just drop. They were giving them also, vitamin A, which prevents the infant from blindness, and from deficiency of vitamin A associated with increased child mortality. The people, if the the children are deficient in vitamin A, they will develop, they will die from diarrhea and pneumonia. Diarrhea and pneumonia were the leading killers children in Eritrea. So the public health, you know, like I say, they were doing their best giving vitamin A to their children. And as a result, they were also giving to the pregnant women like vitamin A, vitamin B, and you know, the health situation was improving. Like I said, the nurses were very careful teaching to save the life of people. Like I say again, you know, they don't stay in their house, in the facility. There was outreach. Outreach means you go to the villages even. Mm-hmm. You go to the villages and teach them, give vitamin A, give supplement vitamin B to the pregnant people. So as a result, I can tell that the overall health of Eritrean people is improved. Even when you go to the far places, there is clinic, you know, there is clinic. If they cannot manage that patient, if the patient's condition is severe, yeah, there is transportation. There is an ambulance to bring them to Asmara, the big hospital. So it was like that. It is improved. But before, there were a lot of people dying, you know, because there was no transportation. There was no health personnel. There was no, I say there was no totally, no health personnel, but, you know, it was limited. But after, after independence, it improved. You know, health personnel improved, clinic improved, transport improved. Then, you know, delivery, baby delivery, not necessary to come to hospital. In the clinic, there were nurses who trained in, you know, maternity. So the maternity and childhood diseases, you know, decreased. So it is it's improving.
And why do you think it improved after independence?
Oh, yeah. The reason why it improved in independence is because, like I say, health personnel increased, like nurses, the number of nurses, nurse assistants, pharmacy, everything, you know, increased. And there was clinics increased. And transport was good. So, for example, if there is no transport, even though even though you will do something, because of transport, the patient will die. For example, delivery, when they are delivering, if it is complicated, you know, if there is no transport and if there is no ambulance, they will die. So after, I don't know, after, I'm proud of the people of Eritrea after independence, you know, the health profession was, you know, very, very, very improved. Yeah, the government was giving attention, you know, to the health of the people. So that's why everything improved. And another, after that, like, for example, if I am talking about the infectious disease like that, for example, STD, sexual transmitted disease like HIV, gonorrhea, syphilis. Also, there was a lot of HIV before independence, and people were dying, you know. Why? Because there was no, like I say, enough staff to teach the people. But after independence, like I say, the human resources improved, and a lot of teaching, you know. If you teach people how to prevent the disease, you know, they will not die. Prevention is better than curing, you know. They will not die. So many the HIV, there were special people assigned. There were teams who are designed to teach the people and to treat. So HIV improved, you know, the other gonorrhea, syphilis also improved because of the intensive teaching, you know. It's not only because I am a nurse giving medication, injection only, but I have to educate the people, the community, you know. Mm-hmm. Yeah, to prevent their service. So as a result, it improved, like also eye diseases like conjunctivitis. For example, if the lady has gonorrhea, the bacteria can affect the eye, and the baby can have conjunctivitis, inflammation, the conjunctiva, you know. So all this, but if ahead, you know, if she is pregnant, she need to be assessed, you know, before everything. She needs to get the medication, you know. After that, everything will be okay. But if she is positive, you know, the baby will be also infected.
And so how, during that time before independence, how were you even treating HIV, STDs, any kind of those diseases? How are they being treated?
Yeah, we were teaching them, we were treating them, you know, but like I say, there was shortage of personnel, health personnel. There was no a lot of teaching, enough medication to treat them. There was no. You know,
so there was also a shortage of supplies and medication.
Medication, yeah. Mm-hmm. Right.
And then real quick, I wanted to go back to ask about vaccines. Were there any kind of vaccines before independence, and were those were you guys able to give any vaccines during that time?
Yeah, before there were also vaccination, like BCG, there were, but it is not only the vaccination, you know, the people were not getting the vaccination because they don't know. So they need to be educated. Like I say, after independence.
My name is Asmite, and the purpose and goal of this interview today is to explore the Eritrean healthcare system before independence. We'll talk about preventative medicine, treatments, the challenges healthcare professionals faced, and how they overcame those challenges. My guest today is Dr. Mengistu Zerazion. Dr. Mengistu, thank you for taking the time to talk with us today. Please tell us about yourself.
Asmite, nice being with you in here. Thank you for the invitation and the opportunity. I'm so honored also to give the interview on the USA annual festival. I'm glad to be here. Thank you.
Mengistu, thank you for taking the time to talk with us today. Please tell us about yourself.
First of all, I want to thank you for inviting me and giving me this opportunity. And I am honored to do the interview for the annual USA festival. My name is Mengis again, and my last name is Rasion. I used to be Gabre, and my nickname is, by the way, Gabre, so they call me Wadi Gabre. Well, basically, I'm Tagadalai, yet still I'm Tagadalai. I joined the Fighters for Freedom in early September 1975, before even existed. So yeah, I've been serving in several fields, in several departments, and while I was a fighter, mostly, and it was sometimes in the military part, and taking care of war injuries. And half of my time also I was serving the civilians and the population around us. So that's my story in short.
Okay, my first question is, how was the capacity and the skilled medical staff at the start of the armed struggle?
Yeah, it is. At the start, we've been, like until the first 3 years, it was almost, we had nothing. It's just a backpack, and with few medicines, and the hell is let's call it the hospital or the center or whatever we have is on our back, in the back. But later on, after 3 years, we start getting bigger and start improving, because at first we had no skilled staffs or medical professionals. After 1973, we got a medical doctor, which is, we got lucky, and he was the first one. I can call his name Haile Mason. Before him, our struggle, we start getting easier, because before that, the enemy was not letting us to stop in a place. We cannot sit in a place for a couple of days even. Every time you have to move, so you cannot establish a medical facility. Not that only in one place, couple of nights, you have to move. So because of that reason, everything we had was in the bag. Everything we had was we carrying it. And it was so, that's what our status at the moment. And that's how I can explain it later on. After 1974, we got, better and better. In 74, at least we got a place where couple medical professionals can sit, and patients can sit there. And of course, after that doctor, after we got a medical doctor, then pharmacists came, other professionals came, nurses start to show up, and then we got bigger and bigger. Especially in 1975 was a big move for Eritrea, Popular Forces for Eritrean Freedom. We call them then Hizbaw Hailtat.
My next question is, was there a convenient facility to practice medicine, and where were you getting medical supplies?
Well, I think the stable facility, I kind of mentioned it at the start. No, we had no stable facilities. From 1975 on, then we started building hospitals. But still they are mobile though. When the enemy comes, you move the hospital to another spot. So there was no a place that, until at least 1980s, even though you have hospitals built every place, so many places, but they are not stable. Sometimes if enemy knew the place and start bombarding it using airplanes, then, hey, you have to move somewhere else. But always to protect that, we've been we've been hiding, like everything was underground. Our patients, our injuries were underground. So even the bombardments were, we were able to take them with few maybe damage. So sometimes you cannot help it, you cannot move, but you keep the place very secretive, everything underground. It doesn't look there is people living around it, but it is a big hospital. Everything is underground, the operation room, they call it the dentistry, the ophthalmologist, they call every professional was just underground, but built nicely. When you get in, hey, this is a real deal. It was very nice, but I can say lately we had stable facilities, but it was very careful staying there. We always have to camouflage the places that can show enemy a sign. You cannot hang any clothes. You cannot wear shiny clothes and walk daytime in the river or around the hospital. Everything is careful, and we watch the fighter planes always also because, so yeah, it is yes and no. It depends on the time of the struggle.
And what is the means of getting skilled professionals to do the work? Was there any training to help with this?
Yeah, I think one good thing about EPLF or Hezbollah Gumbar, everybody is a student and everybody is a teacher. Whoever is lower than you, we are his teacher. Yeah. And whenever there is relatively peace times, everybody goes to school. Everybody is under the tree or whatever trench he is learning. This is a mass. So people came from, nomads, and they were reading, writing, and they went to, high grades like 7s, 8s, from 0, from none. So Hezbollah Gumbar, that's why he was able to, get to this success. Everybody knows what he's doing. Everybody is reading. Everybody is, you can, coachable. You can teach, he can teach, and people came to almost to come to a closer level. Then when they are your level, then you stop teaching them. That means, and the profession is the same way. They teach each other. When new experience was found, everybody tells everyone. They gather together and they transfer it to each other. Whenever there is a professional visitor from Europe or whatever country, he comes with a skill and with equipments, stays a couple days or a week. Then they take every knowledge he got, and we take the equipments he brings as well. So, and it is amazing. The medical doctors become specialists, and some health officers become doctors. Some nurses, in fact, become surgeons. They transferred the knowledge, and that's how we were teaching the staff. But there was also school that was, the school was given to Agar Hakim. We call them therefore doctors, the people who do the work, basically, the most of the work. They are in the field, they are in trains, they are in the war areas, they are in the hospitals. These are in a mass. So there is a training for them. Even there is a training for a higher level, we call them battalion doctor. So there was, education is something else, and it's priority, and everybody teaches each other. And we have of course the schools for the lower level and mid level. Then the doctors teach each other. And that's how they become professionals. And that is like that. Thank you.
And were you treating the Tagalog only, or were you taking care of civilians as well? And can you tell us about some of the civilian services offered?
Yes, as our name implies, we are People's Front for Eritrean freedom. That was our, a goal. People is our priority. Even though during intense times, even in a war, critical times, we still take care of people around us, the people who are in the free areas, liberated areas. So yeah, it is for both. And Hizbah Gumbar does this. I mean, it is our priority. Whatever we have, we share it with the civilians. Every person lives in the area, nomad person, comes to the fighters for help. One help is about the medicine, about his health issues. But it's not that only. Hizbah Gumbar also did something different. In fact, we have, Hizbah Gumbar had two departments. One is civilian. They are equally, they all have equal power. The other is military. So they run their own businesses. So in the civilians, I remember like 1975, late 1975 or early 76, Hizbah Gumbar started to create a mobile healthcare teams. Well, I was one of the beginners there. So what you do is you go to your center, get medicine you can get, put it on your back. You have 5 or 6 people with you with rifles to keep you safe and to keep whatever you have at hand safe. And then you go to the village, like what you have in your background. I was one of them. This is basically, I don't want to brag, but this is my team. And we had a clinic in Zara, but we were moving to a village called Koko, where the Zara mine, gold mine is located right now. These people are Hadarib, I mean Bidawe. So we go to villages and take care of them. Some of them may not, they may not know what we're doing. They might not know where the clinics are. They might not able to come to us because of some issues. We go to them. And this teams, basically, there were some teams inside the enemy area. Some teams were in our area, liberated area. So later on, after some years, when we get stable, and instead of mobile, we starting health stations with 4 or 5 people in it, some nurses and some agar hakim. Then we started health center, a little bit bigger, with a full nurse and even higher than a nurse. Then at this time we have tents, we have places to keep our patients, and we treat them. Then lately we start building hospitals when we get bigger, like when the cities start liberated and we put hospitals. But this is what I was doing. This is what Hizbah Gumbar plan was lasting. You give them care, you build these centers, you have mobile teams that goes to their villages, but it didn't stop there. The Hizbah Gumbar started teaching the villages themselves. We bring some knowledgeable people who can take the courses. Then we start training village health worker in every area. So this was one of my business. So what we do is 20, 30, whatever number they give us, we go to them, we stay around them, where is closer clinic in that area. Then we train them, we give them bags, we supply them, and they go. Every month they come back with information. They come back to take supplies again. They come back for another timely education. So at the end, what we did was, in fact, they had no reference book. We created a reference book for them. In fact, I've sent the book and my message to you guys. One was Agar Nagat Hakim, barefoot doctor, in Tigrinya. The other was Hakimber, the same version, but in Tigray. So I was lucky to give those books as a reference for those people who are serving their villages. So they have a reference now. If something is missing, they can flip the papers and do the job. So Hezbollah Gumbar was doing a lot service, giving a lot service to the civilians.
And what were some of the challenges that you faced, and what shortcomings and limitations would you like to mention?
This is, challenges in diseases and challenges in shortage of supplies. We had a lot. For example, I can say mostly the common problems in the field is basic stuff, like you have malaria, people are dying because of it. It is anemia issue. The malaria kills the red blood cells, and then they get anemic. The women lose a lot of bleeding blood during when they're giving birth. And there are so many reasons that nutrition itself, malnutrition is one of the, so this is everywhere almost. Even with our fighters, it's mostly in the people, but even with our fighters, because there is no enough to eat, no variety of foods. You don't think, in fact, you cannot think about vitamins. You think only about how I feel my stomach. Do I get food to eat or not? That's the issue. So because of that, we had this issue of anemia. Bleeding is common because of the war. But we had a good blood bank. Guess who? The Agar Hakim, the people in the hospital, the people who is giving care to the injuries are our blood banks. We know all of them what type of blood they have. As soon as something comes up, you just call the person and draw the blood and give it to the other one. This is a known solution in the field. So we had a good, in fact, the best blood bank. And so we were resolving it that way. And malnutrition, as I have told you, especially in kids, the kwashiorkor and the marasmus, it's a lack of proteins and other vitamins. And one time also, something showed up early, 1975, 76, around that area. Scurvy was common in fighters because of lack of vitamins. Basically what they've been doing is they were buying lemon and just feed them lemon, give them a lemon, and the scurvy get treated. That's it. You give them medicine for pain, but mostly that is vitamin C deficiency, and you don't have the tablet to give, you have the fruit to buy from Sudan and then give them. And there was also night blindness on the kids, especially in Bet Musora, young kids. After 6, they cannot see. This was vitamin E deficiency, and we bought Burberry from Sudan, and we fed them Burberry, and everybody was fine. So there were some challenges, but Hizbah Gumbar has always a solution. Of course, diarrhea is one thing because of the sanitation thing. And you don't get a lot of water, you know. It's just, if you get to drink enough water, that's, you're lucky. But later on in 1984, 85, there was communicable diseases, endemic diseases that, you know, attacks the population and the fighters. So those days were a real challenge, but Hizbah Gumbar is very fast in taking care of this stuff. I know in the enemy area, people were dying, like, you know, around Barentu and some places, especially when they got cholera. It was like unbelievably. But Hizbah Gumbar always mobilized the whole army, the whole population. And, you know, they do real campaign, and they control it. And, you know, you might lose a few, but basically, like what we see right now, COVID. It is that experience. We had typhoid fever and cholera, meningitis and dengue fever, whatever, relapse fever. All this comes from, you know, poor living status. If you have lice, a lot of them, you know, they transfer sickness from one person to another. So you have to shave their hairs, you have to close, you have to put our clothes in hot, boil them, and then kill everything in the clothes. So every one of us was cleaning, like sterilizing ourselves. This is the Hizbah Gumbar is so fast in these things, and we were able to fight them, get resolution, and we were getting success on all of this. I remember last time, the last challenge was Sharsha Warar. Maybe you heard about the offensive 6. It was our last, you know, for us, it was celebrated that we are gonna get rid of the land, you know. They did everything they can do. And one of the plan was to throw us this fertile gases and call it chemical weapons. And Hizbah Gumbar was, you know, making solutions. We cannot buy masks, professional masks that protect you from gas. We cannot buy, we don't have anything. The only thing we were doing is create our own masks, make charcoal, ground them and put it on the masks so that charcoal is a good protection for this chemical war. And we create goggles using the X-ray films or whatever plastic you get. And people were creating this. Everybody has his own protection on these days. So it is amazing. In fact, what they did, what Hizbah Gumbar did, what the medical team did was the healthcare system. We gave atropine injection for each and every Tagadalai. And we taught him how to inject himself and inject his friend whenever this gas happened. So it is like, you know, this organization was something else. It's still, there is, nobody can explain this organization. Nobody still can tell how we did this one and what was the secret and how did this happen. No one has an answer. It is amazing organization. And it was a good question, yeah.
The last question is, how was childbirth handled during the armed struggle? Was there a hospital or clinic or midwife readily available?
Yeah, first of all, Hizbah Gumbar allowed a marriage, like, you know, around, after the first organizational conference, it was on 7/7, then marriage was allowed. Before that, No one touches no one. Just you respect each other. You might love each other, but you don't touch. It was not allowed. Marriage was not allowed. There is no, basically, you get punished for that. In case something we find someone doing something, then he get punished for that. Not easy punishment though. So that to keep the organization safe. And we cannot take children at that time. We don't have even enough for us. So the organization is supposed to stay, clean. So finally, it is a nature. You cannot stop it. Then they allow marriage. But it was not like, go and do it now. It is, they gave chances to the disabled people, the people who are just sitting and doing nothing, so that they can help. They can get help. They can get children. They can, enjoy their life at least. So little by little, then it became open for everybody. Then we start, getting married, 60, 70, close to 100 people one time, you have nothing, just, you meet, that's it. So yeah, after that, the children came to life and you have to take care of them. And of course, we have a big department and midwifery department that was led by a doctor, Dr. Abraham. And she taught a lot of midwives that can be anywhere in the military bases and in hospitals and in clinics. So at the end, maybe it was like around 80s, a little bit before that, then it is a hospital. The skill maybe was a little bit earlier, but it was not as stable as later on, so yeah, she taught, she trained a lot of midwives, and not only for the military or fighters, the casualty, no, even for the civilians. Because when I was teaching village health workers, on the other side, there were moms, they were getting trained midwives. So it was okay later on. It was available everywhere, but at the start, because of our issue, it was not allowed, and we were careful, but still we were giving service to civilians and the population as a whole. So yeah, finally we got that.
Okay, those are all my questions. Is there anything else you would like to add?
I always get amazed by one thing. First of all, as I have told you, Hizbah Gumbar is the can-do people you get in Hizbah Gumbar. They because you came to give your life. So giving a service is piece of cake for you. It is the easiest thing to do. So everybody does honestly from his heart. When taking care of patients, you give your life for him, especially during the fights and when the injuries are coming to your hospitals a lot. So sometimes you don't eat, but you have to do the job. You have to take care of them the whole time. You give them the dressing, you make the food for them, you take care of them. Sometimes the injuries are not, one or two. There is big front and the whole front fight. So, but one thing amazes me is when you taking care of the fighters, when you treat their wounds, they help you. Hey, Mengis, you forgot something in here. It's even deeper. Check, because he wants to go back. He wants to get cured right away, and he wants to go to his unit, do more fighting. And Ethiopian army, the injuries, they don't want to come back to the front. They create excuse and they make their wounds worse. They put stuff in it and it gets worse. Even they want cut their legs to just go away from the war. Our situation was different. They help you to do the treatment and they tell you, this is what you're missing. Okay, sorry. They give you some power. And at the end, they want to go and they say, hey, I cannot sit for this wound in here, please. Please let me go. This is not one. They make a line for that, to ask you to send them to the front. Of course, as a healthcare provider or their person who takes care, he wants them to stay. Hey, please, this is a little bit deeper. When you go there, it's gonna go worse, be infected, and just stay a couple of days. No, they group together, they run. When you come, to give them the care, 10 people are not there. What happened? I don't know. They ran. Where? It's known. If you know their units, you call and they're there. When they go there, also they get punished. Why did you come without permission? But finally, they cannot do anything with them. They keep them in there are also their healthcare, like Agar Hakim, maybe center for battalion, center for brigade. They keep them there for a little while until their wound is. So it is, sometimes they were making line while I'm sleeping so that they can get me as soon as I get up. We were a place in the Salah Tawara, it's Sabanis fence. So I was taking care of the wounds that are easier, that they don't need to go farther. We were closer to the front, but nothing reaches to us beside the airplanes. So they make line to get me as soon as I get up, to just ask me to send them back. And so it is a blessing to work with this kind of people. You cannot believe it. Sometimes they get once, twice, 3 times, 4 times in the same fight, and they still want to go. So that's what I said. What is Wagumba? What makes them this, to do this? You want to go and do the job. You give your life. So that's one I want to talk about it. And there were times also we had shortages, and we have to take care, use them very carefully. Sometimes you can reuse them by washing them, for example, when injuries are in masses, so you don't have enough bandages, you don't have enough gauzes to do the dressing. So what you do is you wash the gauzes and bandages that you use. But the good thing is you sterilize them, because still they have the marks. Even though you wash them, it's blood. So, but it is sterile, it is clean. We have autoclaves that we sterilize them again, and we do the dressing. We can, it's not even one time, so you can do it several times. So there were times like, some shortages, but it was not always though. Bagumbar was good at supplying things. Basically, it is a lot to be told.
Can you show me where you are in this photo?
Oh, yeah. I am second to the first with a hat. Second to the first with the hat. And this is basically my team. We had a clinic in Zara.
Wonderful. Thank you so much for your time, and thank you for your service.
You're welcome. I'm so happy that you have me.
Overview of the Eritrean healthcare system. Blood Donation and Transfusion Center in Eritrea. Before independence in 1991, there was only one blood bank center accessible to military personnel. After independence in 1991, Mekane Hewitt Hospital started giving blood and then expanded to 8 mobile transfusion blood donation services across the country. In addition to the hospital-based transfusion, the blood bank also expanded National Blood Center in Asmara and a blood center in Barantu. Achievement: recognized and certified as one of the 3 blood centers in Africa. Goals and consideration to improve outcomes. To achieve an accreditation and certification of safety and quality management services in the African Association. Also, to receive the safest product as possible. Blood donation received. Since year 2000, blood donation progressed from direct to volunteer. According to the interview with Ms. Awolka, currently 95% of the donation are received voluntarily. Progress in blood component. Back in the days, whole blood was administered before it progressed to blood component RBC. 10,000 of the blood unit yearly given are RBC. Public awareness. Reach out to community such as schools, colleges, administration, and offices. Promoting education on the importance of blood donation. And public education on the recovery of the lost fluid and red blood cells, highlighting that every 120 days, RBC is regenerated. Guidelines used for administration of blood transfusion in Eritrea as follows. Collection type and screening method is based on the National Healthcare System procedure. Storage adheres AABB recommendation. RBC is stored up to 42 days. Fresh frozen plasma stored for 2 years, and platelets for 5 days. Processing modification. Infusion parameter per MD order. And the criteria for blood donation is the age, body weight of less than 50 kilos, medical history, blood pressure, and counseling is provided, as well as performing transmitted disease screening for syphilis, HIV, and hepatitis C, as well as eating and drinking prior and post-donation are required. Also, the facility provides soft drinks and biscuits.
Hello, my name is Azmira Zerai. I am a registered nurse from Dallas, Texas. Today, we will discuss the success of COVID-19 in Eritrea. COVID-19 pandemic has been one of the greatest global crises in decades. To date, around the world, tens of millions of cases has been confirmed. 2 million people have died when the pandemic first hit, and the lives of billions has been greatly affected. While COVID-19 has been a global problem, the death rate in many African countries has been much lower than originally feared. For example, Eritrea, a young developing country in northern east of Africa, sorry, you there? We do it again. Hello, my name is Azmira Zerai. I am a registered nurse from Dallas, Texas. Today we will discuss the success of COVID-19 in Eritrea. COVID-19 has been Hello, my name is Azmira Zerai. I am a registered nurse from Dallas, Texas.
Today, we will discuss the success of COVID-19 in Eritrea. COVID-19 pandemic has been one of the greatest global crises in decades. To date, around the world, tens of millions of cases has been confirmed. 2 million people have died when the pandemic first hit, and the lives of billions has been greatly affected. While COVID-19 has been a global problem, the death rate of many African countries has been much lower than originally feared. For example, Eritrea, a young developing country in Northeast Africa that by late December 2020 reported less than 1,000 positive cases and 1 death due to COVID-19. However, despite the relative success, little focus has been devoted to Eritrea response. How did Eritrea manage to keep COVID-19 at bay, and what factors contribute to its success? Number one, a swift action and decisive leadership. Decisive leadership is a key factor in determining success against COVID-19. In addition, a strong, swift action guided by sound, scientists-driven advice, public health fundamentals, and evolving evidence is also vital. Research suggests that denial and even brief delay or hesitant made a considerable difference in the spread of COVID-19 in many countries and around the world. Number two, past experience. Another important factor was that Eritrea was able to draw upon its own extensive experience fighting disease. Number three, clear communication and public buy-in. Eritrea's response has been characterized by clear, consistent, and frequent communication, as well as local buy-in and adherence. Eritrea's national healthcare policy aimed to ensure equity and access to essential health service at an affordable cost. Priorities include public health fundamentals such as clean waters, sanitation, and vaccination, addressing maternal and child health care issues, and the control of communicable disease. To date, the severity of positive cases has remained invariable, mild for all patients, and the median period of hospitalization remains at 21 days. And the country has demonstrated an impressive recovery rate.
Background introduced to government. All right. And Mariam Mikhail Dad, professor of immunology.
My name is Anda Mariam Gabra Mikhail. I am a professor of immunology and general mythology of chemistry. My background, after I received my first degree in Ethiopia, I went to Boston University and then received my postgraduate degree at Harvard University. I then served as a professor at Harvard University in 2004 when Eritrea established the medical school Orota. I was called to run the school, and I moved back home from the United States, and I am still living here in Eritrea. The School of Medicine provided to the society a huge victory in regards to health and health care. Because the government vision was and always is to strive for better quality health care services to the whole population and to all areas of the country, and to sustain development goals throughout the nation. The government opened a very quality and well-organized medical school, and for that reason, the students who graduate from Orota Medical School are excellent doctors. And not only medical school, but for the first time, the school started a 7-year dental school program, and the graduates are serving every corner of the country. All doctors were foreign graduates or learned overseas, But this Orota school is teaching doctors not only medical education, but also the education that goes parallel with Eritrean culture, society values, and issues. This is a major achievement. So there was a need to produce Eritrean educated doctors. In the recent years, especially in the past 15 years, the new graduates are solving problems and needs in surgery, internal medicine, pediatrics, and it is even widening the field continuously. The graduates are highly competitive with the world's top-level doctors. The school believes that first we build a person, then a doctor. This means a patient cannot be healed just by medicine, but it requires for doctors to have values in communication, discipline, culture, how to approach a patient, and being fair, and to all those who graduated from the school are respected in that sense. They are very humble and down to earth, and they value each and every patient. As early as 1991, the motto of the Eritrean government was to develop sustained and high-quality health care for all citizens, and the medical school and dental school solved a lot of health challenges. At this time, the people and the government of Eritrea is successfully facing the challenges that are before us, especially in destroying our main enemy, as the enemy is getting buried once and for all. And I am sure that things will improve always, as the government priority is health and health care of each and every citizen in the country. Awat Nahafash, and thank you for inviting me for the interview. I'd like to thank every healthcare worker we were able to interview, first of all for their service to our country, and also for the time they were able to dedicate to this project.
Thank you all for watching, and we'll see you next year.